Hello, I am Olivia Hurd, and this is my presentation about Denmark and the United States healthcare system. In my presentation, I'll be discussing what both Denmark and the United States healthcare systems are like, and talking about both pros and cons of both healthcare systems. So, what is healthcare like in the United States? The United States is currently ranked last compared to other industrialized countries, such as Australia, Canada, New Zealand, and the United Kingdom. The U.S. has two forms of healthcare systems, private and public. Private, which is provided through employers and other organizations, and public, which is funded through the government and other health organizations, such as Medicare, Medicaid, and the Children's Health Insurance Program. And the United States spends the most money to other wealthy countries on healthcare. They spent about 17.21% of their gross domestic pay on healthcare. So, what's the healthcare system like in Denmark? Well, Denmark is currently ranked number 1 in healthcare as of 2023. Denmark has universal healthcare, which is free access to healthcare to all their citizens. It's funded through tax revenue. U.S. citizens are all under one healthcare insurance called Insurance Group 1, but they have the option to be under Health Insurance Group 2, which they are able to buy their own and customize insurance. And compared to the United States, Denmark spent only 10% of their gross domestic pay on healthcare. So, the pros to the American healthcare system. So, the United States does pretty well in preventing and treating cancers pretty early and has the best survival rates for colon, rectum, lung, breast, and prostate cancer. The United States also does good at administering more state-of-the-art medicine and performs the most clinical tests compared to Denmark. And also, doctors are paid more in the United States. So, what are the cons to the American healthcare system? And as you can see, unfortunately, this is a long list. So, the United States has the highest rate of death from avoidable and treatable conditions, and unfortunately, has the highest rate of maternal and infant death rates. People in the United States see the doctor less often than most other countries, and Americans have lower life expectancy compared to other wealthy countries, which is only about 78 years. And as you will see in the pros to the Denmark healthcare system, is a big age gap. 45% of Americans say it's too difficult to afford healthcare, and 40% are actually in medical debt. And as of 2021, 8.6% of the US population is uninsured. And if you're unsure what that means they don't even have medical care or medical insurance too. Also, the US wastes a lot of money on preventable conditions such as diabetes and heart disease, also lung disease too. So, what are the pros of the Denmark healthcare system? Well, as I said earlier, Denmark has universal healthcare, which is free healthcare for all citizens and residents. Also, you have access to free dental care up until the age of 18 years. Life expectancy of Danish citizens is 81 years, which compared to the United States is roughly about 4 to 5 years. Also, Danish senior citizens have the right to free home care services whether they decide they want to live in an assisted living home or live in their own homes. So, Denmark's healthcare system doesn't sound half that bad, right? Well, of course it doesn't sound that bad, but of course there's always going to be some cons. So here are the cons to the Denmark healthcare system. So despite having free access to medical care, some other medical care services and specialties are not included. Those include chiropractic and psychological care, which you do have to pay for. Denmark is currently ranked low on treatments for breast cancer and colorectal cancer, and if we look back at the United States, they're doing pretty good at treating those types of cancers. Denmark is also pretty slow in introducing new cutting-edge technologies, and once again, as I said, compared to the United States does pretty well in introducing those. Also, in Denmark, it's a long time. You possibly are risking a long time in getting into a doctor's appointment or to see a specialist. This is also mainly due because there aren't a lot of doctors in Denmark. This is also especially true for surgical procedures. You're at a high risk of having a long time to get that surgery, and you're also at risk of having that surgery being canceled too. Here are my sources. I hope you can see them. I have my scholarly sources and then other sources I found. So my 4 scholarly sources and then special guest, other sources I found online. hope you enjoyed my presentation. I hope I did pretty well. I hope you have a fantastic summer. And yeah, thank you. I hope I did good.